So the kind of initial option is obviously glasses or contacts. So if the keratoconus isn't too advanced, then the optometrist can prescribe glasses or contacts, especially if it's not too irregular. But then if it starts becoming a bit worse or glasses or contacts aren't tolerated, then you can start looking at pretty non-invasive things like scleral contact lenses. And some of the optometrists in Sydney are now doing wavefront guided scleral contact lenses, which is pretty state of the art. So that's basically using some of those scans that we have in our clinic to customize or shape the scleral contacts to make them individualized for our keratoconus patients. And these give phenomenal vision, and they're quite comfortable because they're quite wide. So patients usually tolerate those really well. All that's required is to remove them at the beginning of the day and at the end of the day, and put them back in at the beginning of the day. So there's a special suction device that can be done for that. So that's really what most of my patients are opting for now, because the technology with scleral contacts is just unbelievable, and we have really talented optometrists in the community that are able to make them. And then some ophthalmologists or corneal specialists will offer PRK. So we've spoken about PRK before, but that's a type of laser eye surgery, and they'll combine that with corneal cross-linking. So that's another way that you can improve the vision. And then that's called topography-guided PRK with cross-linking. And then there's the patients that aren't suitable for laser, can't tolerate scleral contacts, glasses and ordinary contacts don't work. And then you're looking at more invasive procedures like corneal transplants, and more recently, CAIRS, which is a type of procedure where corneal transplant tissue is used. So real corneal tissue is used, and it's made in a little kind of custom-made arc segment, and this is placed inside the cornea, so under the surface, to try and offset some of the irregularity of the cornea. So this is obviously way less invasive than corneal transplants. And I do think this is a very exciting advancement for keratoconus. It's definitely a way forward for treatment. But you can see you've got many options. You've got glasses and contacts, you've got scleral or hard contacts, then you've got potentially in a small cohort of patients, the topography-guided PRK combined with cross-linking. You've got CAIRS for some people, and then you've got corneal transplants. And then corneal transplants falls into full thickness and partial thickness. So you can see it's kind of mind-blowing how many options there are.